You awake? Yeah. You're still feeling that pressure. Okay. Has it been constant or on and off? Okay. Yeah, it's making it hard to sleep. I'm sorry. On a scale of 1 to 10, 1 being, it's nothing, and 10 being absolutely excruciating pain, how would you rate it? Okay. It looks like we gave you some medication not too long ago, so let's try a few different things and see if we can't improve the situation. And if those things don't work, then we'll try some different meds, okay? Okay. Have you been able to sleep at all? I'm sorry. Okay, let's see what we can do. So, to start, let's take a look at you, okay? First, just going to check your temp. I know you have this sensor, but I just want to make sure we don't have any hot spots. Okay. It's all reading the same thing. I'm going to take a look in your ears, okay? And if this is too unbearable, let me know and we'll figure out something else, okay? So, I'm just going to pull your ear back just a little. Okay. Okay. Yeah, it's still pretty inflamed in here. I can tell it's pretty irritated and tender. I know, I'm sorry. Check the other side. Oops. Feel me pulling this hair back as well. And okay, I'm not seeing quite as much fluid as before, but I am still seeing a fair bit of inflammation in here. It's quite red and irritated. Can you try and describe for me what kind of pain or pressure you're feeling? Is any of it sharp or... Okay, so it's just like a dull throbbing. Feels like water's in your ears, okay? Yeah. Okay. Can I just get you open for me real quick? I'll take a look in your throat. Make sure I don't see. Okay. So I do see a little bit of drainage, but it's clear. A little bit of redness and irritation, which I expected. And then really quickly, I'm just gonna take a look at your eyes, okay? I know, but I gotta make sure. Look up. Everything is the color that it should be. Okay. Other eye. Look up. Okay. Relax. At least your eyes. Take a quick listen into your chest. If I can get my stethoscope out of my hair. Well, so it goes. Okay. Just warming that up a little bit. Okay. Can I get you to take a deep breath in for me? And out. Good. And again, deep breath in. And out. Deep breath in again. And out. Okay. And last one. Deep breath in. Good. And out. This over here so I don't have to deal with my ponytail. Okay, I'm gonna tap on your chest a little bit, okay? Just looking for any crunchies. So I need to take a quick peek at your skin, okay? And part of that does require that I use my light again. I'm sorry. But I need to make sure that everything is the color that we want to see it, okay? I'll try to keep the part of your face brief, alright? I'm just gonna take a look at your hairline here. Just making sure I don't see any redness extending into the scalp. Okay. I need you to close your eyes for just a moment. Thank you. Alright. You can open them if you'd like, or keep them closed. Totally up to you. Okay. I'm not seeing any evidence of any rashes or erythema. So I'm going to feel under your jaw. We still have some mandibular nodes present, but they appear to be the same size, so that's okay. I'm going to be lightly pressing my fingers into your skin. Just looking for the presence of any edema. Okay. So, alright. I'm gonna try something. A couple things actually to see if we can't help you relax enough to get some sleep, okay? So, first thing I want you to do, if you will, is just close your eyes, okay? I don't want you to try and clear your head or anything like that, because I feel like that can create a sense of anxiety when your thoughts don't just disappear. So just let any thoughts that come into your head just come, okay? So what I'd like you to do is hunch up your shoulders, really squeeze them up towards your ears. Take a deep breath in, and when you exhale, let your shoulders drop and relax. Good. Let's do that again, okay? So inhale and tense your shoulders, hunch them up. And exhale, just relax. Let them drop. Feel your arms just hanging heavy, okay? The next thing I want you to do is squeeze your fists and curl your toes, so like you're making a fist out of your feet, and squeeze them both as you inhale. And exhale, just let them go, okay? Let's do that one more time. Inhale and squeeze. And exhale, just let it go. Okay. Now I just want you to just focus on your breathing for a few moments, okay? Is it okay with you if I touch your ears just lightly? Okay. If at any point it feels like it's too much, let me know and I'll back off, okay? But in the past, this has helped me. Just starting very gently. Just some pressure. Around the most external parts. Is that okay? Then if that felt okay, I'm going to try and move your ears just a little bit, okay? Is that okay? hold just a little bit of pressure on your ears and see if that helps and release some of that pressure that you're feeling, okay? Okay. I'm gonna do it again. Alright. Is that helping at all, or it is? Okay, good. Just letting your ears have a moment to rebalance, relax. Let's do that again. give your ears a break, but first I'm gonna take a look inside of them one more time just to make sure that everything is okay here. So, just pulling your hair back. Sometimes doing your massage like that can loosen some fluid in the ear, so I just need to make sure that, well, whether or not that's the case. I'm not seeing anything like that. I'm going to do a couple puffs of air though, just to make sure that the tympanic membrane vibrates appropriately. Okay, let's check the other side. Let's get myself over just a little bit. Kind of. Just pulling the hair back a little. I don't see any fluid in the ear visually, but let's a couple puffs just to make sure. Okay. Good. Real quick before I put this away and then take a look in your nostrils, okay? Just to make sure that I don't see any drainage here now. Okay. Okay. And gonna check your throat one more time because if the ears are draining, that's where it's gonna go. Okay. So, thank you. Yeah. I'm not seeing any change. Okay. Put that with the other one. Okay. So now what I'm going to do is I'm going to do something called lymphatic massage, okay? So I did notice that there was a little bit of edema, not a lot. 1+ spitting edema. So I'm just going to very lightly massage your face and neck in long strokes, okay, and help encourage some of that to drain. It should help you feel more comfortable. Okay. If at any point this feels uncomfortable, let me know, right? So, How are you feeling? Okay. Good. Are you feeling a bit more relaxed? Okay. Good. That's what I want to hear. Okay. One moment. Let me take a look and see where we put it. Gonna brush your teeth real quick here, okay? Provided I can open this. Okay. Do you mind opening for me? Thank you. I know it's not perfect. Gonna get your tongue just a little. Alright. Go ahead, spit in the basin. And totally okay. Alright. So, how are you doing temperature-wise, my dear? Are you warm enough? Too warm? Okay. Do you want me to get another blanket, just in case? Okay. You sure? Okay. That's fine. I'll leave you be. So, I do need to do some charting, okay? But you do not need to keep me company. So if you'd like to close your eyes and go to sleep, please do so.